We are glad your eyes on Church of Uganda Family TV. Thank you so much for loving Family TV. Thank you so much for watching all our programs. Here we are. This is Health Port. Health Port brings you maternal health and early childhood development issues that you didn't know or that you knew but neglected. We bring them on board so that we keep our children safe. And HealthPort is brought to you by Makerere University School of Public Health. Edrine Mukalazi is my name. We are with Dr. Hanifah Namala Sengendo. Last week in the episode we talked about the developmental milestones and we talked about a few. We are going to continue with the other milestones we didn't talk about today. But I'll first of all ask her to say hi to us. Doctor, we are glad you've come back even in this episode to talk about the milestones. Doctor, we have been anxiously waiting for this episode. Kindly greet our viewers.
Dear our viewers of our beloved TV, Church of Uganda Family TV, the sponsors of this program, Makerere University School of Public Health, thank you very much for giving us an opportunity to talk to our mothers, to talk to our parents, to be including Edrine and Jonah. So it is exciting that we have an opportunity to talk at a time when mothers can listen. You know, when the baby is sick and you tell the mother all these things, they cannot listen. Yeah. What they want is their baby to get fine. So thank you very much for thinking ahead so that we can be able to give back to community and then people can be happy, you know? Yeah.
So last week, we looked at, you took us through the milestones from zero or from 1 minute to 9 months.
Yes.
And then maybe just to give us a few aspects, important milestones in that period that a mother should not ignore out, just in case they didn't watch it last week.
So last week we actually talked about important milestones. The milestones or the stages that show that the child is growing normally begin when the baby is in the womb. After the baby is born, the baby should be able to cry. As they keep growing, they should be able to use their hands. They should be able to control their neck. How do you know as a mother? We shall go to that. They should be able to start smiling by 2 months. 3 months, they should really be smiling. 6 months, they should be returning that smile. But also, you should be able to see that your child is actually focusing on their hands, like they are trying to pick things intentionally with their eyes. You should be able to see that your baby is looking at you, but also focusing on you, and is able to recognize common faces. This is the person I stay with. This is my young, this is my sibling. Although they are not talking, but they should be able to show that they know these people. They don't refuse them, okay? As they get older, they start, showing their physical maturity, starting with sitting. By 6 months, the child should be able to sit.
By themselves.
By themselves, unsupported or a little around there. Then they start crawling. They begin by, lying straight on their tummy, and then they start folding to be able to move. At that time, they can be able to show likes and dislikes. Like they can cry if they don't want the tea. They can, kick things out of their way, at that time. And they also get interested in using their mouth. So they pick a lot of things and put into their mouth. They are sitting, they are beginning to crawl. At this time, by 9 months, the child should be able to stand. The ones that are fast, they should be able to start the baby steps of walking. Okay? So basically, that's what. And all in this, you should be able to observe, is the child having good neck control? Because we said that child should be able to lift their head and turn like this. If the baby's head is just falling, like this, the baby might have a problem. If the baby is not focusing on you and is just looking and as even if you are, trying to get attention, the baby is not really, picking the same attention, there could be a problem.
Doctor, before we continue to the other milestones, we have babies who, while trying to crawl, they don't crawl this normal way of sleeping on their tummy and then stretch their hands. They just push their hinds.
Ah, okay.
Is that also normal?
Well, yeah, some of those things could be familiar. You'll hear that even their elder sister was crawling like that. Yeah, that a bit of it. If there are no other additions, yes, but eventually they get to the normal one because they are mimicking walking. You see, when they are crawling, they are in a way beginning to start the walking, because even when you are to sit, to stand up and walk, you begin like in a walk, in a crawling way. Have you ever noted? You do this, then you are like this, and you stand up. So the baby is actually beginning to walk in a way. So they are putting the hands down, folding the legs, so that eventually they will release the hands and then fly,
So these things are so interesting.
Yes, I know. And we are talking because we need, from a public health perspective, we need our grassroots mothers who are watching Church of Uganda Family TV to know it. We are not talking any big words of science, Yeah.
So now we continue to the other milestones after 9 months.
So after 9 months to about 1 year, because below 1 year, we call them infants, the smaller infants. Then bigger infant is under 5. So we usually talk of under 5, under 1 year. Okay? So from 9 months to 1 year, the child should have increased all these other things. The child should be able to walk. The child should talk common words, mama, tata, the common people. They should be able to respond to their names. They should be able to hold.
This time their minds tell them that this is your name.
Yes, now they know that when I say Edrine, when I say Hanifah, I actually mean you. So when you say Hanifah, they will respond very fast, because now they attach that name to themselves. So then they will know. At this time, they actually they can hold, and they are feeding themselves. Not so well, but still they can. So if you see a child who picks food but cannot put it in the mouth, instead of the mouth, the child puts food up in not in a playing way, because as they feed, when they are full, they can put food anywhere. But if you see, but if you see, they smear because they're enjoying, they are mimicking, you smearing what? Vaseline. So they are trying, because at this point, they are really copying. So you are smearing Vaseline when they see this food.
The sauce. They think it is also Vaseline.
They also try to imitate, to do whatever you are doing. So 9 months to 12 months, they should be walking. They should be recognizing you. They should be refusing people if they want.
There's something we are talking about, that if the child doesn't take this food, puts this food in the hair, but not in a playing way, then there is a problem.
Yes, if you continuously watch your child, they can't pick food well, like the hand doesn't spot the plate, That's why at this time we give them nice looking plates. They are good colored, they have pictures, because they can see a picture, okay? So, if you see a child whom you've put food, and the child cannot get interested in the food, like when they bring pilau here, you also get excited, isn't it?
Of course.
So the child should also get excited when they see their bottle, when they see their cup, when they see the food. They should yearn to pick it.
They even know this is mine. When someone else touches it,
they know this yellow is my plate. That is why if you give it to another person, they will go for that person, because they are now becoming self-centered. I don't use selfish. They are self-centering themselves to know that this is mine. I am there. I am a being. I am I. So they tend to, to cling on to their things, even if it's a basin. It is what? It is mine. I should be the one to touch it. No one else should do it. So, at this time, if you see a child who cannot, like you put food and the hand is trying to go but does not reach the food all the time, then there could be a problem. Sometimes, yes, they may be like they are picking and they are not and they put in the mouth. But if it is consistent, the child cannot focus their hands and bring the food to the mouth, then there could be a problem. It could be the eyes the child is not seeing. It could be that the brain that connects the talking of food going to the mouth and the hand, they are not connected. So the child may pick the food, but the brain does not tell that hand to move towards the mouth. The brain might be wrongly telling the child to put the food this way. Or the hand may not be able to move to the mouth area because maybe there is a problem with the muscles, or the brain is not talking, because the brain inside here is talking, you know. And at this age, yes, it's sending information. Do this. When you see food, you know, be ready to put in the mouth. When you put in the mouth, chew. When you chew, you know, be able to swallow, you know, something like that. So, but what we are saying is that at this moment, they may not do it perfectly. They will do these things. You put the food, they are throwing it. Some of those things, they are also trying to explore the environment. What happens if I throw the food? So when you say like, no, don't do that, then they will, you know. They are trying also to see what are the values of this of this home. Is it to put the food in the mouth or whatever? Or to throw it away. At this time, they will actually start to want to dress themselves at about 1 year. And usually they dress their panties in a funny way. Usually one leg in, you know, both legs in one side, you know. But then you see they are trying to do something. By 1 year, they are running. They know where their bedroom is. But also that time, they like bathing. They like water.
Even boys?
Yeah, at that time, it is. At that time, it is a bit more general. Okay?
Doctor, let us go for a short commercial break, but I still have questions about boys.
COVID is a pandemic and is a terrible disease. This thing kills in days. We should take everything it takes to prevent and avoid getting it. Like washing hands. What do you have to pay to wash hands? Put on a mask, you know, distancing. And if you are not attending a function, you are not attending a burial, will not stop that person from being buried, then don't go. And it's good we are in a digital era. We send mobile money as condolences to the people concerned and say, you know, we are sorry, we cannot come, you know, the situation. As simple as that. Our culture requires us to socialize, you know, be near somebody and console them. Yes, correct. But the situation prevailing at the moment doesn't allow. You know, these are simple matters. But you know, we take it simply. You have to wait for the police to remind you, people to run after you. But life is yours.
Protect yourself from COVID-19 by washing your hands with soap, wearing your mask, keeping your distance, getting vaccinated, avoiding crowds, staying at home, and avoiding shaking hands and hugging.
Welcome back from the commercial break. This is Health Pot. This program is brought to you by Makerere University School of Public Health, together with Church of Uganda Family TV. We are with Dr. Hanifah Namara Sengendo, taking us through the developmental milestones. And we have now reached 1 year. Doctor, we are back. Now you are still telling us that this baby wants so much to bathe.
Yes, they like water, irrespective whether they are boys or girls.
Okay.
The issues of boys come now when they become adolescents. But this time they want water, they want to splash, they want,
They play around
they
where the
play
mothers are
around
washing
water,
from.
they get attached to their things, like if they have a ball, they can be able to throw their ball, but they get attached that this is mine. So I told you at this time, they are getting self-centered, you know. And remember, at this time, they have not yet even started socializing so much, like going to school. We have preschool, you know, from 3 years or 2 years. But by this time, around 1 year, they are really self-centered to people they know. Okay? They are talking. They are talking. If you have a child 1 year and cannot call mom, cannot say the common names, then there could be a problem. Because at this time, they should be able to do that. They are walking, they are getting excited. They like, now this time, they like to climb. Why? Because remember at 9 months, they were fearing. They would put one leg, then they are, oh, this is height. Now at 1 year, they begin now to say, I can climb. So they tend to get a lot of falls. Because as they try to climb, they fall. That thing, you find they want to climb the cup, you know, because, you know,
Whatever they see
whatever
mounted.
they see is raised. They want to go up the tables, they want to go up the chairs, because they are like, I can reach heights. The phobia for heights starts reducing. And at this time, they start to want to write. Because remember, now they can touch. Whatever the way they touch the pen, usually they begin to hold the pen, but like this, because they are fine, whatever has not yet developed. So they would want to hold, and they will imitate you like you draw a ball, then they will try, because you are doing it, they will do it. You know, when you dance, they will also do what?
Dance.
When you jump, they will try to imitate the what? The jumping, but they can't jump with the 2 legs up. They will try to jump, but usually they are not balancing.
But you can see them trying.
But one leg will be up and down, then they jump and they fall, because they are not yet fully balanced to jump with the 2 legs. So they start writing, they like, you know, just coloring things, because they have seen you, you know. At this time, they want to watch like cartoons, because they know characters now. They are good colors. So when the cartoon laughs, they will laugh back. You know, because they are doing what the cartoon is doing. Not really like they are interested in, they are following, but what the cartoon does is what they would do. So then afterwards, as the child continues growing, going to school, you know, they like their books and bags, then socializing. So from 1 year, from about 2 years to 5 years, it is more or less these other things catching up. But also, at the point around 3 years, they start actually understanding negative reinforcement. For example, you say, don't do that, they will not do it. You know, they begin at around 1 year, they will stop and continue. Then they look at you with a negative eye. So when they reach 2 years, they can really know they are in trouble. So you say, don't do that, then they will know they are in trouble, or some of them will
And
throw
they don't
up.
do it again.
They don't, well, they forget and do it, but not in a way that they are big-headed. It's just that they are trying to pick what you don't. So they are also testing you. So when you are not consistent, they will know mommy is a joker. So if they are just throwing things and after drinking, every time they throw the cup, you refuse them today, tomorrow they do it and they look at you to see, are you still telling me not? So they will know, mommy is a joker. So they will continue. So they're also testing your consistency. It starts there and it continues. Of course, then they start observing. By 3 to 5 years, they start knowing also some of their privacy. Like at 5 years, 3 years, they will know that for us we are boys, these are girls. They start noting that we have different features, you know. They will start, you know, those few things, they will start noting that ball is for boys, you know, it's for us boys. Girls go and play from the other side. So pretty that's that. And of course, when they start going to school as toddlers and the preschool, they learn to socialize. Now they stop the other things of refusing. So that's why nursery, the first day, at about 3 years, they cry day one. They can cry because they have been attached to the home environment. They are seeing many babies. They are seeing everybody. They are getting structured. At home, they would run anywhere. So day 1 to 1 week, they cry. Afterwards, they enjoy the socialization because human beings are social animals. You remember that? So now they start enjoying the social. Then they cry when they don't go to school. So all these things that we've been talking about are related to early childhood development. If they don't happen, that is what we are going to discuss.
What causes this? Why don't they happen? What stops them from happening?
It begins early. Sometimes, well, it can begin right when the baby is still in the womb. When the baby is in the womb, maternal issue, mother things can let this child not to grow. For example, if a mother has a disease, the disease that can be transmitted, that can go to the baby, the brain may not grow well. There can be things that run through families. For example, I'll give you an example. If a child has maybe a cleft palate, the tongue doesn't grow well, or the jaw, that thing might be running from families. So when the child is just born, the baby will not be able to suck because the palate has a problem. And if you call me, my baby is not sucking, I'll first look. I put a torch and see, is the mouth, the palate, is the jaw well grown and configured, or there is a gap, or there is something in the jaw, you know, that is failing the baby from sucking. So those things may happen when the baby is in the womb. The baby may have had problems with the nutrition. That's why we need maternal nutrition. When the mother is pregnant, she should be able to feed very well. Because if the baby does not get the vitamins that they need, does not get enough blood, the brain may not grow appropriately. Okay? Sometimes the things may just happen that the brain doesn't grow very well. So you produce...
Without any cause.
Some things we don't know, they are idiopathic. We don't know the causes. The baby just comes out and the baby's brain is not fully grown at the level of 9 months while in the abdomen or in the uterus, you know. So those things can happen like that. But the major thing, at the time of birth, things can happen. I told you, now you are also paramedical. The baby should breathe within what time?
Within the first minute.
Within the first minute.
Yes.
So if this baby dare not cries within the first 1 minute, it means the baby has not breathed, has not taken a breath that is bringing the baby to life. So that breathing, when the baby cries, the first time, blood enters the lungs. Rather, the air enters the lungs. The blood and oxygen and everything wakes up. Because the baby was sleeping while in the womb. So when the baby cries the first time, the baby gets oxygen, the brain wakes up and knows, oh, I'm now on earth. So if those things don't happen, the brain gets retarded. The brain does not get good oxygen. The brain continues sleeping. So it is very important that the baby cries within the first 1 minute. It is very important that mothers deliver in health facilities. Why? So if the baby stays so long in the birth canal, the baby gets so tired. The baby may cry very lazily. Or as the baby moves through the birth canal, the baby's brain may be compressed. Because the baby's head was big or the canal was small. You know, if you have a 14-year-old giving birth, normally the bones of the mother may press on the brain. So this brain will actually have some parts not functioning very well. So the baby will not have these milestones.
Doctor, what else can mothers do to avoid?
So what mothers should do from the time when you plan to get pregnant, plan. Don't just get pregnant as an accident. So that you plan the way you eat, so that you plan to go to hospital, and they identify some of these things. Because when you go to hospital, they'll give you supplements like medicines. They'll give you the vitamins that you need that help your child to grow, you know. That's why I think in Uganda they say agenda anywe eddagala. Because when you go for antenatal, you are given what? You are given meds, you know, but those meds are both for you and for your baby. So the first thing is to actually make sure when you get pregnant, you go to hospital, they examine you to see, they ask you questions. If you have any of those family things, they can be able to help you. You go to scan, you can see a baby who is okay. In the scan, you can also see a baby who is going to be a vegetable. Like you see the baby, the head is very small, or the head is very big, or the hands have not developed, or the backbone, the spinal cord, but you call it a backbone maybe, has not developed or is coming out. So all those things can be identified during pregnancy. But also during the first years of growth, early childhood development years, those are very critical. Because I told you the other time that by the age of 1 year, 50% of the brain has grown. So if you do anything that antagonizes the growth of the brain, then you will actually end up with a child who has these problems. The milestones are not coming out, the child is not talking, the child is laughing anyhow. The child, because the brain has not functioned well, you get children who may have cerebral palsy, children whose limbs, the brain cannot coordinate with anything. They can't drink well. A lot of things. It's another day for us to discuss cerebral palsy.
Yeah.
But otherwise, mothers, fathers, but first mothers, the onus is on you. You are the gatekeepers of your baby's health. Follow this so that you can be able to see if your child misses or delays, then you can consult and be able to be a good doctor within your own household.
Wow.
Yes.
What about the father?
The father should follow suit. Why I am stressing mothers? Because you are the first person who is with the child most of the time. But fathers are very important. You are the one whom I would tell first, and then you give mothers money to go and consult. You are the one who can actually call Dr. Hanifah, my child is like this. So fathers should actually, you are the fathers who give mothers money to go for antenatal. Sometimes you refuse them. So, yeah.
All right. Thank you so much, Doctor. We are indeed impressed. And I believe this episode has been a blessing to very many mothers out there. And let us not take things for granted. Let us take action as mothers, as parents, even fathers. Jonah, you should take action. We were with Dr. Hanifah Namara Sengendo. Edrine Mukalazi is my name. Jonah Jal, the producer. And together with Brenda Tijakira, Bantam in transmission, Tony Santo on social media. This is Health Port, brought to you by Makeda University School of Public Health. Enjoy your weekend. Be blessed.